Turning now to the race for a vaccine against COVID-19 and a promising new study about one of the potential vaccines now under development. Earlier, I spoke with Dr. Imran Ali. Good morning, Dr. Ali, and thank you for joining us. A new study is out this morning on one of the potential COVID-19 vaccines and how effective it could be for older people. What are you hearing?
This is a very good question, Mona. This is because I'm a geriatrician and I see this all the time. Older adults traditionally have a more hard time trying to mount an immune response with the vaccine. That's why vaccines are not always effective. You see, as we get older, the immune system weakens. We have fewer T cells and less working B cells. So the phase 1 trial results were published in the New England Journal of Medicine showing that it does trigger an immune response in older adults, which is a promising sign that the vaccine will indeed work. But this is still a phase 1 study results that we're looking at right now. We still have to wait till phase 3 to see if the actual vaccine does work to prevent COVID disease in older adults.
And Dr. Ali, flu season is nearly upon us. And you say you're seeing some concerns when it comes to people getting flu shots. What are you most worried about?
I'm really worried that a lot of parents are not getting their kids vaccinated for the flu and other, normal routine childhood vaccines. And everybody's afraid of going to doctor's offices, which is sort of understandable as we're now seeing some cases rise in certain states. But I do want to say that the Department of Health and Human Services has expanded the pharmacist's ability to give vaccines to kids over the age of 3. So you could potentially get the flu vaccine at your local pharmacy now, and also measles and rubella vaccine as well. So there should be no excuse.
And more Americans have been drinking alcohol since the pandemic. There's new research today on why this is such a disturbing trend. What are the key takeaways?
Well, Mona, I'm seeing this myself personally as I am treating patients who have attempted suicide. COVID has really upended everything, and people are more depressed and turning to alcohol, especially women who have now taken more responsibilities of homeschooling and maintaining the workplace, the job, and everything. And just in general, alcohol use is being seen much more in society. So it's very important because alcohol can also worsen your outcomes with COVID should you get infected. If you really have problems with alcohol, you should seek help. You can also call the national hotline at 1-800-662-HELP or go to findatreatment.gov where you can get some more resources to help you with any problems you may have with alcohol.
Our thanks to Dr. Ali. These are trying times, and it is no surprise that it is taking a toll on all of our mental health. And so Dr. Ali said that if you are seeking trouble, you heard him there, with alcohol, you should seek help. He also gave the national hotline, the suicide prevention hotline, which is 1-800-662-HELP, which I wanted to reiterate because, again, these are unprecedented times. These are trying times, and it's understandable to ask for help.
Important information there.